And now, Rob on the Road, exploring Northern California.
Hi there, it's Rob, and welcome to my home. It's good to see you. This is where I'm connecting with you every day on Rob at Home. During this time that we are in stay in place, it is so important to know that we are not alone. Have you heard about Engaged SAC? It's part of Sacramento Mayor Steinberg's call to civic engagement. We are going to be talking with Shira with the Atrium. She's going to join us to talk about her nonprofit, hiring unemployed artists to make masks needed to help prevent the spread of coronavirus. Just one way someone in our community is stepping up to the plate. But first, an update on the program Joshua's House and what will be the first hospice for homeless along the West Coast. Marlene von Friedrichs Fitzwater is the founder of Joshua's House and joins us to talk about how the coronavirus is impacting her plans for Joshua's House.
Thank you.
And so glad to be with you this day.
Yes.
This is a tricky time, huh? How are you doing?
It's a really sad time because it's really, not only personally dealing with the threat of the COVID-19 virus, but to see the impact of that on those who are living homeless, who are not sheltered. They're, of course, now at much greater risk than any of us, and with much less resources, much less access to medical help and prevention, and even much less access to understanding the virus and what the risks are.
I have been out when it comes to the grocery store or things like that are essential. And like you, I know lots of members of our community who are homeless. And I drive by to see if they're there.
Mm-hmm.
And there is a distant and despondent look.
Yes.
And energy
Mm-hmm.
in every one of them.
You are absolutely right. I see that as well. There's just such a sadness and loss of hope and loss of that there is help or they'll somehow get out of this or be able to get shelter. They're very despondent. They're very scared. And it's very noticeable.
This takes me to your story of Joshua. Joshua was and is your grandson.
Mm-hmm.
And tell me what happened with Joshua for people who do not know.
Joshua was an amazing, loving, kind, smart, talented young man. Unfortunately, probably around when he graduated high school, I think it was shortly after that, he began to have problems. He had a drug addiction. Much of his adult life after he graduated high school, he was homeless. We were particularly close because I was there when he was born in the delivery room. I helped to care for him. I babysat him a lot when he was growing up. We were just very, very close. And Josh was unique in that he was a letter writer. He wrote incredibly beautiful, long letters all through his life. So no matter where he was, I'd get these incredible, wonderful letters. And he'd call and get in touch in other ways as well. And in about 2012, I think, I became aware. I was at the UC Davis Cancer Center, teaching in the School of Medicine and working with cancer patients. And I became aware of the homeless issue in a way I hadn't been aware of it before. I met a patient who had been diagnosed with liver cancer. But then when I started exploring and doing research, I discovered that we were seeing a lot of homeless people with cancer who came in, were treated, and then discharged back out on the street because there was nowhere for them to go. And as a cancer survivor myself, that was appalling to me. Even worse than that, I became aware that if someone was terminally ill, they didn't have access to hospice. I would talk to Josh about this, and he confirmed that and said, Grandma, yes, I see people who are living on the streets, who are homeless. who are terminally ill from a disease and don't have hospice, don't have any kind of care like that. And so we would talk about that and talk about how we wanted to change that. And then in 2014, he died on the streets in Omaha of an overdose.
Hold on right there just for a minute. I'm so sorry.
Thank you.
2014, Joshua died.
Yeah.
And I just want to honor that for a second, because I know that the story, when you have to tell it, it continues. But I want you to know that we hear that.
Well, thank you. He was only 34 years old, and so losing him just had a huge impact on me and really changed my career, my direction, where I wanted to go. So I began then researching. I assumed, okay, we don't have hospice services, a place for terminally ill homeless people to go in Sacramento, but they must have it in other cities, other areas. So I started doing the research on it and discovered at that time there were only about 5 places who were attempting to care for terminally ill homeless people. The oldest is St. Joseph's in Washington, D.C., which started with the AIDS epidemic and has continued on and does incredible work for the homeless. The newest one at that time was the In Between in Salt Lake City, Utah.
I love the words in between, but yours even will be more than that, because it is going to tell the story of people who are homeless and capture what could end up being, Marlene, the most beautiful chapter of their life, oddly, by being in hospice for homeless, because for many of them, it will be the first time they have felt unconditional love.
Absolutely, and that's so important to me. And I know it was so important to Josh too, to have a place where they could feel complete love and support, be made comfortable, but also be allowed to share their talents. We're going to have things like poetry workshops and dance and movement and storytelling and services that will engage them and allow them to show their talent and share their talent.
Joshua, in his letters to you, was almost like a reporter from the front lines, if you will.
Yes.
Even while he was struggling, he would write to you about the struggles of others. He would see people around him. He'd say, Grandma, yes, those people with cancer are on the streets, dying.
Yeah.
What would he say to you right now in a letter about what we're seeing today?
Oh, I think he would be heartbroken to see a new disease, a new virus that is having such a huge impact, particularly on people who are living unsheltered, who don't have quick, easy access to health care, who don't have ways to protect themselves, don't have access, for example, to just soap and water on a regular basis, or hand sanitizer, the things we take for granted, they don't have.
What's going on with Joshua's house right now?
Well, sadly, this virus has had an effect on how we were proceeding and where we were going, because everything has stopped. We can't have the kind of meetings, we can't have the special events to raise money. Everything's kind of come to a halt, and we're short probably about $600,000 so that we can get construction started and finish construction and get open. And the sad part to me is this is a time I wish we were open, because we'd be able to get the terminally ill homeless people off the street, get them into a safe shelter where they could be protected and cared for, and they wouldn't be at risk for acquiring this virus. So it's a sad time, and it's a difficult time. How do we raise money now, given that we can't do special events and bring people together? So we're really looking at that, looking at what we can do to get this moving forward and to get Joshua's house open. We so desperately need it. There is not another facility for the terminally ill homeless on the West Coast.
How many people do you estimate are dying on the streets, homeless now in our region?
Right now it's probably 3 or 4 a week. Some weeks are worse, some weeks are a little less. But that's here in Sacramento. You know, so think about it statewide or think about it countrywide. I mean, it's an enormous number of people we're losing. And as this virus continues and infects more people, we'll obviously lose more folks who are unsheltered.
What would you say, Marlene, to anyone watching right now in search of hope and in search of a light at the end of the tunnel?
Well, I'm an optimist. And so I do think there's a light at the end of the tunnel. I think I'm really proud of us as a state and in my neighborhood, how people are really adhering to staying at home, not interacting with everyone else, you know, really keeping social distance, all of those things. Unfortunately, our brothers and sisters who are homeless can't do that very well. But I think there is hope. I think we will get past this. I think we will have a vaccine for it. I think we will know how to treat it and how to prevent it. It may change how we interact with others and behave in the future. Like, I'm not sure I'll ever shake anyone's hand again. I'll think of different ways to greet people and show my...
Do you really mean that? Do you really mean that?
I really mean that, because I really see not only is this virus being spread so quickly and easily, but colds and flu. I had a 5-week bout with pneumonia this winter, and I have never been that sick in my life. And it really made me much more aware of things I touch and making sure I carry hand sanitizer with me and wash my hands several times during the day. And so I think this experience that we're having with this virus will probably teach us to be a little bit safer in the future.
As a physician, do you think, have you thought about, did I have COVID?
Oh, I absolutely have thought that. And in fact, my physician has told me that once they have a test to see if you've had it before, if you have the antibodies for it, she'd like me to have it just to see, because as I mentioned, I've had pneumonia before, but I have never been as sick as I was with this. And so if it wasn't the virus, I would not want to go through having the virus, because it must be horrible. But I think we do need to kind of understand how to be a little safer and take a little better care of ourselves. You know, you mentioned earlier something that I think is also really kind of profound to observe is they've always, I think people who are homeless have always felt lonely and forgotten and invisible and get ignored. People don't look at them. They don't stop and talk to them. They don't engage with them. But now it's like even greater. I mean, it's even more distancing. And I know some of the homeless people I've talked to in the last few weeks, that feeling of total disengagement, of total isolation, of total, one young man said, it's like I'm not even a human being anymore. No one will talk to me. Nobody will approach me. And I think that's just the most incredibly sad thing. So I think now is a time when we can do what we can do in a safe manner, but do what we can do to let these folks know they're not forgotten, they're not invisible, they're human, and we care about them.
Marlene, I just want you to know how much you are loved and how much you are appreciated, not just by me, but in this community. Well, Marlene von Friedrichs Fitzwater with Joshua's House. Thank you, Doctor.
Thank you.
And now more on the mayor's call to civic engagement in Sacramento from Mayor Steinberg. Shira Lane heard that call and her nonprofit, the Atrium, is answering. Shira is working with this wonderful effort to help employ creatives and provide safety. Shira, good to see you.
Oh, thank you so much for having me.
Absolutely. Tell us about this project and how people can get involved.
So what started off was I have a bunch of creatives, the Atrium, we're a creative innovation center for sustainability. And we have a lot of creatives at our, I don't want to say disposal, but we have a lot of creatives that are part of us. And
that you have access to.
That's a really good way to say it. And so a lot of them are struggling right now with the crisis that has happened. You know, many events have stopped, everything that they know has stopped. But many of them who can sew have been sewing relentlessly for all the healthcare workers and everything else, and they've been donating. They've gotten to a point where they no longer have money to buy supplies.
Yeah, it's costing them. It's coming out of their own pocket.
It's coming out, and these are people that don't have money. You know, these are people that have lost all income, everything. And so what we decided to do was we wanted to create a marketplace for all creatives to sell their masks. And then people who need masks can buy them, and then the artists can use that money either, one, to pay their bills, or two, to be able to get more supplies to make more masks for the healthcare workers.
This jumped out to everyone when Sacramento Mayor Steinberg shared it, and it's good news travels fast. Yeah. And Engaged SAC is part of the mayor's initiative for civic engagement. This fits right in with that. It's like a rally call for people to use their services, the creatives, and then people to step up and say, I need a mask. This is also coming on the heels of the recommendation that people wear face coverings over the T-zone, which is right here. Mm-hmm. And it is something that is being recommended. What are the orders looking like? Are you getting a lot of orders?
We're getting a lot of orders, and I've actually been telling people, don't advertise it to us so much yet, because I'm still trying to get a lot more creatives involved.
What can we do to help you? How can we help you?
Oh, that is so sweet. Well, right now we'd like to know if there are more creatives that would like to join, and if they want to join, they can go to atrium916/masks, and there's a form there that they can fill out saying that they want to jump in and kind of get on the platform. It takes a little bit to get them on, but we do all the work for the creatives. We will take care of sales tax. We will take care of customer service. We will take care of everything. All they do is they get a sheet that says, here are the masks that you make today. And then we send them the shipping labels, and they ship them out, and then we give them the next order, and we pay them the day that they ship them out.
Wow.
So
I do want to point out, I think it's important to say that the Atrium is a nonprofit.
Oh, yes.
Yeah. So it's a nonprofit, and you're bringing people together to do this, to help employ people who have lost income right now, but also to do something for the greater good.
Yes, we're doing this just to help. We're not, all the money goes to the artists. We're just adding on a little bit of fee just so that we maintain our costs. So we're not going into it, but we're trying to just help the community. And that's what the Atrium is. We're a creative innovation center for sustainability. Our goal is to bring together creatives and sustainability and find solutions. So
that's a beautiful sentence. That is a really, really nice sentence. Creative innovation for sustainability. That's great.
Thank you. And so we also created a resource page. It's a very robust, which is atrium916/resources. And they have a lot of resources for independent contractors, creatives, because the creative economy is really a very robust. And that goes from filmmakers to artists to architects to, it's a lot. So we created a resource page for all the creatives there, and we update it pretty much a couple of times a day. And we're holding creative economy meetings, which these creative economy meetings are for creatives to figure out what's available, citywide, what grants are available, figuring out the SBA loans that are coming out, the PPP and the idle disaster, and what do they mean. We're going to try and make them weekly because things are changing so quickly. And we want to give resources to creatives right now who are just out of work. Because, normally a creative, will have their job and then they'll have their restaurant job as a side gig, and now they have nothing. And so what can they do? So we will be doing these every Thursday. Trying to think of what.
Let me ask you this, Shira. Where will that information live so that people can find out about the meetings and find out what's on the docket and that type of thing? And how can they join? Do they need to be on Zoom, phone? What is it?
They can join any of these. They are Zoom webinar meetings. You can find us on Facebook. We've got a Facebook page. You can find us on
Under the Atrium.
Under the Atrium. You can find us on our website, and we post the videos. We keep the videos and we post them. We post
Of the meetings.
on Facebook. Yep.
And what is your website?
Atrium916.com.
Gotcha. Okay. So we're hearing a lot about, we want to hear a lot about some good news stories. And I think that just looking at you and seeing that smile, we found one.
Oh, so sweet.
And I'm just so grateful that we have found each other, because you have a way for us to not think about right now in this moment, right? This is all we have, the stress of what's going on and how we can get active and helping.
I think it's really important that we start looking at this, this is like a jolt. And, we can look at this in many ways. I said this last night, actually. Sometimes you have to bang your head on a wall to realize you're going in the wrong direction. Mm-hmm. And somehow we've banged our head against the wall with this.
As a world.
Yes, as a world. This is the first time that we've come together as a world.
In a long time.
What are we doing about that? How are we going to do with that? Are we going to go all individualists, or are we going to think of this globally and solve this globally? And how is that going to change how we attract, how we work on other problems that we have in the world as hopefully this goes away? And I think that there's going to be a lot of things that are going to change, and we need to look at okay, what can we do now? We can't do what we normally did, but let's look at what we can do now. And find solutions and be of service. And I think one thing that really helps people get through is to feel like they're helping, to feel like you're doing something. And
we have to find a way to be creative. We have to find a way to be innovative, and we have to find a way to sustain. And look at what y'all are. You're creative innovation for sustainability. Shira, I thank you so much for sharing some encouragement with us, and we will have all the information on the screen for people to join in, for creatives to join in and help make these masks to help keep people safe, and the creatives get paid for that as well as the weekly meetings that help bring information all across the board. Thank you so much. Joining us from the Atrium in Sacramento, right?
Thank you so much. Yes, Sacramento. Thank you so much for having me. Thank you.
Thrilled to have you here on PBS. Good to see you.
Thank you.
Okay, bye-bye. That's Shira Lane. And coming up on Rob at Home, keep your eyes open and look for interviews from the Sacramento Regional Family Justice Center. Faith Whitmore has important information to share with everybody regarding domestic violence. Now, she says, more crucial than ever.
So many times, Rob, we hear people say, well, it wasn't that bad, or he didn't mean to. Well, you know what? Exit the situation. If you want to continue the relationship, do it from a distance. And if at some point you really believe that he has changed, and I'm using him and her, although it goes in every single direction, if you believe it's changed, then step back into it gradually, but don't do that in place.
And singer Sandy Patty speaks out on her own battle with the coronavirus and a message she has for all.
I'm glad that some of you are feeling so good, but it is still important to stay home. It is still important to shelter in place. It is still important to wear a mask when you're outside, because what you're doing is you are inadvertently protecting the medical community that we must have on the front lines. And so now that I'm feeling better, I'm thinking, oh, I want to get out and I want to do this and I just want to drive through Sonic and I want to, no. Because if I do that, that could put my friend who's on the front lines at risk. So it's changed my perspective, and I hope that for those reasons, we can still practice wisdom and do what everyone says are the wise things to do in this time.
Thank you for joining us here on Rob at Home. It's great to be with you. Check out Facebook, Rob on the Road. That's where we're posting videos and you can interact with us as well. And also tune in on Monday nights right here at 7:30. We'll see you.